is sponsored by Sullivan County Community Hospital.
Smoking, high blood pressure, a history of heart disease. These are just a few of the risk factors that make you susceptible to heart disease. Now at Sullivan County Community Hospital, for just $50 out of pocket, you can check your heart. Julie visited this month to get this heart scan and talk to a wife who knows firsthand how $50 likely saved her husband's life.
Sullivan County Community Hospital is now offering coronary calcium screenings.
It's called a coronary calcium scoring done by way of CT scanning, and it will detect the presence of atherosclerosis in your arteries, which is an indication of coronary artery disease.
Why should you get this test?
There's many factors that can determine what kind of coronary artery disease you have. There's many risk factors such as overweight, high cholesterol, family history, smoking, obesity, high blood pressure. So it just depends on some of the factors and what kind of a risk you might have as to whether you feel like you need this study or not. This test is usually a test that's recommended for men over 40 that has any of those risk factors, or women over 50.
That's me, a woman over 50. Thankfully, my only risk factor is my parental grandmother who eventually died from coronary-related issues.
Well, we have a very brief history form that we ask you to fill out, and the patient's then taken to the CT scan room. You're, of course, put into a gown. We hook you up to some EKG leads on your chest and take a very short, brief scan of your chest with the CT scanner.
Breathe in, hold your breath.
And that's basically the test. Those pictures are then sent to a separate workstation and a computer, and it's ran through a program that helps identify that calcium in your arteries. And we give the patient a nice, pretty color copy of a printed report that shows their score in what we call the Agatston score, and that's an indication of coronary artery disease.
The scores range from 0 to 400.
Minimal, mild, moderate, and extensive. And obviously, if you're in the extensive range, we suggest that you see a cardiologist immediately, as well as your family physician or the physician that ordered it.
My score was 5, meaning minimal evidence. Leslie Lentz, director of marketing at the hospital, also had a minimal score.
I was curious to find out what my score was and what the condition of my heart was. My family has a history of heart disease, so I thought for $50, I'll go and have the test done and see what the numbers tell me.
Her husband was a different story.
I brought my score home and showed my husband my score, which piqued his interest, him thinking that he would probably have a better score than I did. So he says, I'm going to have it done. So he came in and had it done. And his score was alarming. It was a high score, high enough that his family physician immediately referred him to a cardiologist. He had no symptoms. He's very active. He had no pain. He had nothing. So it was just a blessing that, you know, he was curious enough and was thinking about health and to go and say, I'll have it done. It's a scan, you know, and it's relatively inexpensive.
$50 that could save your life.
For us, it was a gift.
Look at your lifestyle, look at the risk factors you might have for coronary artery disease, and it's up to you. You need to determine whether you feel like you need that done or not.
Well, the coronary calcium screening can be scheduled by simply calling. Like they said in the story, it's $50 paid at the time of your appointment. Insurance will not be billed. To schedule, simply call the radiology department. And if you want additional information, all you have to do is visit their website, schosp.com.